and the premiums are going through the roof. True or false?
Well, I think they're not going through the roof, and it's not even. In some places, as we've seen recently from the Kaiser Foundation studies, some people have about the same. Some people have even a little reduction in some areas, and some people, yes, have substantial increases in premiums, and that's unfortunate. But very frankly, I'm sure you remember, prior to the Affordable Care Act, premiums were doing the same thing, and in fact, in many cases, going up more rapidly. So, yes, that's of concern to us. But what was of more concern when we had millions and millions of Americans who could not get insurance, who were one health care crisis away from bankruptcy in their family. They now have access to an affordable quality health care system, to private sector insurance. Now, when you deal with private sector insurance, you charge different prices for products, and what people do when they go to the supermarket, they compare. They now have the opportunity to compare by going to www.healthcare.gov the policies that are available, the prices that are being charged, what's good for them and their families. We think that's a very positive step forward. We think over 10 million Americans now have insurance that didn't have it before. That's good for not only them, but it's good for the system. It's good for hospitals and providers who have the ability to get coverage and not charge the rest of us for health care for somebody else. Share that cost across the board. So are there problems? Are there challenges? The answer to that is yes. But is this system working to give people access to affordable quality health care? It is.
What do you think the biggest problems of the Affordable Care Act are, and what would you like to see changed?
Well, I think the biggest problem is getting to a place where we have a much slower growth in the cost of health care. Now, we don't want to give up some of the things we have, i.e. much better diagnostic tools for the medical community, but that costs money. Prescription drugs are obviously great benefits to keeping us healthy, to resolving illnesses when we get sick, and to making our lives higher quality. We're also living longer, and the longer we live, obviously, the more need we have of healthcare services. Those are challenges, but we can meet those challenges. And one of the things that the Affordable Care Act has been designed to do is look at this and try to flatten out the cost increases by making sure that all of us participate, the healthy and the unhealthy, so that our insurance is spread over a much broader risk pool. And getting everybody in the system, of course, was an idea that Mitt Romney adopted in Massachusetts that came from the Heritage Foundations, a very, very conservative foundation, mostly Republicans, overwhelmingly Republican supporting, which said everybody needs to take personal responsibility for getting health care. Romney adopted that idea in Massachusetts, and what we have said, we think you need to be involved, but we're going to help you if you don't have enough money to pay for it, because we think in the long run it's better for you to have insurance, keep your family healthy, so the rest of us will save money, and you will save money as well.
House Democratic Whip Steny Hoyer with us for a couple of more minutes. The criticism from the Democrats, Congressman, is that Democrats aren't doing what you're doing and going out and promoting the positive aspects of this and letting the Republicans define this and categorize this as all sorts of negative things. How come the Democrats haven't gone out and sort of promoted the Affordable Care Act the way you're doing right now?
Well, I think we have, of course, and this is what, as you say, that's what I'm doing today, but that's what I've been doing for years. And I think a lot of other Democrats, including the President of the United States, have been doing that. Secretary Burwell has been doing that. But there is no doubt there are large money folks who are libertarians or conservatives who think government ought to be out of everything. Donald Trump says he's going to get rid of the Affordable Care Act, but he says, by the way, don't touch Medicare and Social Security, which of course are government programs. So the fact of the matter is, I think that we need to sell it. We need to make sure. But the best salesman for the Affordable Care Act is going to be the Affordable Care Act. And as the years go by, as has happened with Medicare, as years go by, people are going to see this is an extraordinarily important opportunity for them and protection for them and their families. So it's going over the years, sell itself just as Medicare has done.
Democrat House Whip Steny Hoyer. Congressman, thank you very much for your time.
You bet. Thanks a lot. Bye-bye.
725, Big 550, KTRS.